Hello and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. First, the highlights. Governor Babajide Sanwo-Olu warns Lagos residents to take necessary precautions during the festive season. And his counterpart, Umar Fintiri in Adamawa, and other government officials received the COVID-19 booster shot. And the UK reduces COVID-19 self-isolation to 7 days for those with 2 negative results in England. Thank you for joining us. Are you organizing or attending an event? Well, if you must, outdoor activities are highly recommended. According to the Nigeria Center for Disease Control, NCDC, make sure that venues do not accommodate more than 50% of normal capacity. Ensure sitting arrangements allow for physical distancing. Also make sure there's adequate hand hygiene or hand sanitizers at the venue. Ensure proper face masks by all attendees in closed settings. Ensure adequate ventilation, or in addition to other preventive measures. Now, the agency reported over 2,000 new COVID-19 infections, the highest daily case tally since the 4th wave started. The last time the country had a higher daily COVID-19 figure was at the beginning of the year during the 3rd wave of the pandemic. Here's more on the pandemic update from last night.
2,123 additional persons in Nigeria have tested positive to COVID-19 in the last 24 hours. According to the Nigeria Center for Disease Control, the latest figures were reported from 10 states and the FCT, indicating an increase from figures reported earlier. Lagos led the chart with 1,552 cases, FCT logged 197 cases, Edo had 155 cases, Rivers 81, Delta 44, Plateau 33, while Kwara registered 30 cases. Kano logged 16 cases, Enugu 12, Gombe 2, and Bauchi registered 1 case. The new tally has increased the total confirmed cases in Nigeria to 227,378. The report also includes a backlog of confirmed cases, discharges, and 0 case from Sokoto State. 101 patients have been discharged in the last 24 hours, increasing the total number of recoveries to 211,761. There were 4 additional deaths resulting from COVID-19 complications in the last 24 hours, leaving the fatality toll at 2,989. Currently, there are over 12,000 active cases in Nigeria, while over 3.7 million samples have been tested so far. More than 8.9 million eligible Nigerians targeted for COVID-19 vaccination have received their first dose, while over 4 million persons have been fully vaccinated. The total global confirmed cases have surpassed 276 million, while deaths are beyond 5.3 million.
The Lagos State Governor Babajide Sanwo-Olu has called on residents to take necessary precautions to avoid any mishap and be security conscious during the festive season. The governor expressed this at the 2021 Community Day celebration at Police College, Ikeja. He also used the opportunity to appeal to the public not to disregard the COVID-19 safety guidelines while celebrating this period.
As we're going into the Yuletide season, please let's be very vigilant and let's make sure that we're our brother's keeper. If you see something, as we continue to say, please say something. Finally, is also, like they've said, around the COVID-19 protocols. I want to thank you very much because all of you have continued to imbibe all of that. I can see you wearing your face mask and you are continuing to keep it. We're getting out of it, but we cannot be completely, be relaxed. Let's ensure that in all of our engagements, let's continue to just keep those simple protocols, of ensuring that, we use our face mask. Places where we go to, especially if it is in a closed environment, let's make sure that we are using our face mask to speak to ourselves so that we can reduce the prevalence of COVID-19. There's a new variant, and by the grace of God, we will overcome COVID-19.
Christian faithful have been encouraged to take matters of COVID-19 seriously and observe every safety protocol provided. Well, the advice is coming from the General Superintendent of the Deeper Life Bible Church, Pastor William Kumuyi. He was speaking during a media parley ahead of the church's global crusade.
Concerning COVID-19, I want to say that from my observation and from my looking at things, I know that COVID-19 is real. And it's not fake, it's not politically arranged something to do whatever. It's real. We've had people who are real COVID-19 situations, and they were in isolation. In fact, one of our men, one of our pastors, was about passing on. According to him, he had said his last prayer because in that isolation, he had seen other people dying, just going like that. And then I knew about it, and I called him on phone and I prayed with him, and the Lord brought him back to life. In America, we have a family. The child went to school and then got COVID-19, came back home. The father, the mother, the 3 children, making 6 of them, they all had COVID-19. And again, they called on phone, and I prayed with them, and by the grace of God, everything was fine. Just this week, in that is Democratic Republic of Congo, one of our leaders there was in isolation, and it was COVID-19. And again, they called on phone, I prayed, I got the text yesterday, it's now discharged, everything is all right. So COVID-19 is real, but God has solution for every problem.
And Governor Omar Fintiri of Adamawa State is re-emphasizing the need for those who have not been vaccinated to do so, while those who have completed their doses come out and receive their booster shots. He made this remarks at the Vaccination Center of the Yola Specialist Hospital when he received his vaccine booster alongside members of the state executive and heads of security agencies in the state.
COVID-19 vaccination remains a critical public health response measure to prevent the spread of the virus. Recently, concerns about the Omicron variant has led states to expand their vaccination programs to include booster shots. In Adamawa State, Governor Omar Fintiri has now set an example as he leads other government officials to receive the booster dose. He's calling on those who took their doses 6 months ago to ensure they take a booster one because of its effectiveness.
If you look at it, for those of us that have taken the first and the second dose, it has really helped in mitigating against the hospitalization and the death as regard of the virus. So I think it's something that is encouraging, it's something that we should take because it helps, and for whatever fear that we've been entertaining, by now I think it's something that we should disregard it because we have not seen the counterproductive as regard this vaccine.
The state says it's also working to achieve its target of vaccinating about 200,000 persons by January next year.
This mass vaccination campaign, we are targeting about 200,000 before the end of January, and already we have vaccinated over 200,000 that have received first and second doses. So we are very optimistic we will meet the target. Today His Excellency has received it. It will also give moral booster to many people who have even come, particularly even during this festivity, we are likely to meet those targets.
Early in the month, the federal government approved the COVID-19 booster dose, which they say gives greater protection against the virus.
And the NCDC is harping on safety measures that Nigerians need to take to protect themselves and their loved ones this holiday period. The Celebrate Responsibly campaign is also targeting the entertainment industry, transport industry, religious settings, security personnel to promote adherence to the preventive measures. We're joining us to talk some more about this is Dr. Akiala Ishaku, who's a public health physician. He joins us from our Abuja studio. Thank you for joining us on the program.
Thank you for having me, Melissa.
All right, tell us, what have you noticed? And this is where you are with regards to adherence to the safety measures as, you know, the holidays are kicking off.
Malin said, I can categorically tell you that we are losing our guards, despite officially the NCDC has declared us in the 4th wave. This is because I was privileged to be in the market today, and I saw people even without face masks. I was also privileged to drive through a motor park, and I saw a lot of people without face masks. We have abandoned the non-pharmaceutical measures and intervention and as a country. And I strongly believe that Nigerians are gradually losing their guards to these regards. What we just need to do is just to actually reiterate the need for people to actually adhere to the non-pharmaceutical measures. You go to banks, even the bowls where we used to be washing our hands before, there are no waters. The bowls, the taps are abandoned. You go to even public places, they are left abandoned. People find it very difficult to get adhered to the simple non-pharmaceutical measures. So we are losing our guards, and then there are more cases coming up. You can see that within 2 weeks, we have recorded over 500 cases, 500% of the daily cases being reported. So I think Nigerians need to adhere to the non-pharmaceutical measures. I want to commend the governor of Lagos State for actually championing the cost for advocating for the non-pharmaceutical measures.
Yes, and you know, with all of this, one wonders what are the other expectations from the bodies who are in charge, the Ministry of Health, the Steering Committee, I mean, the NCDC. What expectations, again, what do you expect from them, the relevant bodies, to really minimize this 4th wave? We have from the Africa, and that is the Africa region, WHO, that is urging countries to sequence between 75 to 150 samples weekly, and this is to be able to detect the Omicron variant. Are we even doing that?
Yeah, so I agree with you that we need to be on our stand guard to actually go into genomic epidemiology and surveillance. I agree with the WHO AFRO that we need to do at least 75% of basically samples that we have collected, even from inbound travelers and travelers in-house, to actually track the emergence of new variants. This is quite key, and I want to, prescribe to the Presidential Steering Committee that we need to deploy more resources now in genomic epidemiology. Merlin said we need to also have a paradigm shift from genomic epidemiology to actually do mortality surveillance. We need to actually look at how many people are dying, why are they dying, what are they as a result of which pronounced comorbidity, and then for us to be able to have actually model to see how we can be able to prevent this. Merlin said on the onset of COVID-19, we used to have task force. Where are the task force now? There are people that were enforcing the non-pharmaceutical measures, interventions in public places. But, we have lost our guards. So I want to reiterate that NCDC, through National Primary Health Care, through State Primary Health Care, State Ministry of Health, should constitute task force. That in this youthful season, the task force should go around and be able to enforce the use of non-pharmaceutical interventions. These are key. You will agree with me that a lot of people have traveled now for the youthful season. Once we open up, we start returning back January, there will be more increase in number of seropositive cases of COVID. And then I am not a prophet of doom, but I strongly believe that this will not lead to a crash in our healthcare system. And so we need to actually adhere. So we actually need to actually go into that. The NCDC must actually also think of reducing the coordination at the center and give states more independence. And, you know, last time I was on this station, I was advocating for the establishment of State Center for Disease Control, just like the way it was done for NARCA. So I strongly believe that those should be the conversation that we should be having as we go into the new year, because we'll be having more outbreaks of diseases such as cholera, such as meningitis. Lassa fever is with us, and a lot of, you know, diseases. This will go a long way. So we have a whole lot in our hands to actually be able to handle. But I strongly believe that we'll come out of this, and then it will actually end in praise.
Hopefully. We appreciate your time always on the program. Thank you so much, Dr. Akele Shaku is a public health physician. Thanks for joining us.
Thank you for having me.
Well, still ahead, it's just a few days before the second Christmas of the pandemic, and the Omicron variant is fast spreading. We have more on this in a moment. Welcome back. The National Agency for Food and Drug Administration and Control, NAFDAC, and the National Primary Healthcare Development Agency have destroyed 1,066,214 doses of the AstraZeneca COVID-19 vaccine. These were part of the 2,594,100 doses of vaccines received on the 11th and 29th of October 2021. Our correspondent, Emperor Simon, has more.
The truck conveying the expired COVID-19 vaccines arrives at the Goza dumping site, located 2 kilometers away from the Idu train station in Abuja. 1,066,214 doses of the vaccines are to be destroyed. They are part of the 2,594,100 doses of AstraZeneca vaccine received by Nigeria on the 11th and 29th of October 2021, out of which 1,527,886 doses were said to have been utilized.
We have successfully withdrawn.
The Executive Secretary of the National Primary Healthcare Development Agency and the Director General of the National Agency for Food and Drug Administration and Control, NAFDAC, give details on the expired vaccines.
We had developed countries that procured these vaccines and hoarded them in their stores. At the point that they were about to expire, they were offered for donation.
If something happens, we can recall through our track and trace setting, and if it expires, not our fault, NAFDAC will receive it.
Every bit of the expired products is crushed to pieces to ensure they do not get into the wrong hands. Many of these vaccines were donated to Nigeria almost at the time they were about expiring, raising the question of whether developing countries like Nigeria are now being turned into dumping sites for COVID-19 vaccine. With only less than 10 million Nigerians out of the over 200 million population in the country said to have been vaccinated, vaccine hesitancy remains a major challenge in Nigeria. But authorities say they are optimistic about meeting the target of vaccinating 110 million people by the end of 2022. As Nigeria continues to make efforts to get more people vaccinated, one only wonders how long it will take the country to exhaust its current stock of vaccines to avoid wastages such as this one. Emperor Simon, Channels Television News.
Away from Nigeria, while countries across Europe consider new curbs on movement, U.S. President Joe Biden is appealing to all Americans to get vaccinated to fight the Omicron variant, sweeping the world days before the second Christmas of the pandemic. Omicron infections are multiplying across Europe, the U.S. and Asia, including Japan, where a single cluster of COVID-19 cases at a military base has grown to at least 180. Here's more with our Washington correspondent, Maria Bird.
The U.S. is on its way to another COVID-19 crisis. U.S. President Joe Biden gives a COVID-19 address on the wake of the holiday season.
Let me answer some questions that lay out the steps the Vice President and I are taking prepare for the rising number of cases experts tell us we can expect in the weeks ahead. First, how concerned should you be about Omicron, which is now the dominant variant in this country, and it happened so quickly? The answer is straightforward. If you're not fully vaccinated, you have good reason to be concerned. You're at a high risk of getting sick. And if you get sick, you're likely to spread it to others, including friends and family. And the unvaccinated have a significantly higher risk of ending up in a hospital or even dying. Almost everyone who has died from COVID-19 in the past many months has been unvaccinated.
Recent studies suggest that the Omicron variant can be just as severe as the Delta variant. Healthcare professionals predict that the unvaccinated are going to soon overtax U.S. hospitals.
And that's going to be very difficult for hospitals that are already struggling with Delta COVID-19 patients. So the death toll, I think, in the end is probably going to be similar to what it would have been with Delta. However, this is going to occur faster because of the way Omicron spreads.
As many Americans prepare to spend time with loved ones over the holiday season, the demand for COVID testing has made a sharp increase over the past few days. Despite the projections that the recent spike in COVID-19 virus rates will only get worse, the U.S. government has not been successful with implementing a federal vaccine mandate. From Washington, Maria Bird, Channel Television News.
And Maria joins us now virtually. Hi, Maria. I mean, with the Omicron variant being the dominant one in the U.S., what are states' governments doing? Are they imposing more restrictions this holiday?
Hello. You know, unfortunately, we are in another, as you said, the second Christmas with COVID-19. And now we're having a variant, the Omicron variant, that is spreading faster than what we've ever seen before. And so you are seeing some states, a handful of states, you have California, New York, Hawaii. Some states are putting mask mandates in place for the unvaccinated. The challenge with that is that how do you know when someone walks in your store if they are definitely vaccinated or not without being able to require them to show you their vaccine card. And so that creates a challenge, but you're not seeing widespread across the country where mask mandates are being put back in place. But the nation's capital has a mask mandate for indoor areas back in place, and they're expecting that to go until late January, early February. And so it has been predicted, even Bill Gates has stated that he sees this is going to be one of the worst viruses that the U.S. has seen as far as the infection rate and how quickly it spreads, even if it's not as severe as the Delta variant, as far as how ill people get. But for those who are unvaccinated, we are seeing a major increase in those who are losing their lives. And so I think the president is hopeful that people are going to take a stand and get vaccinated and even get their boosters. But at this time, we are seeing something that I think many people did not expect with how fast it's sweeping the country.
Indeed, and one really wonders with the sort of 6-time increase, doubling time of the virus Omicron, why a few states are more affected than others. But tell us, are there still those who don't believe in taking the vaccines, the anti-vaxxers? And the UK, for example, is recording an all-time high of those who are taking booster shots. What's the situation in the US?
Well, what we've seen in the U.S. is that many of those who received their first and second dose of the vaccine have adopted, the majority of those individuals have adopted the boosters. You do have a few because you see that people are even still getting sick, even maybe not to the point of requiring medical care, that have been vaccinated and still becoming ill. So you have a few of those vaccinated with the first and second dose, a little hesitant about the boosters. But overall, it was pretty consistent. We have not seen a major spike in people going out to get boosters. What we're really seeing is people getting tested because they're just concerned whether or not they're vaccinated or unvaccinated, whether or not they could be carrying the virus.
Oh, and many thanks, Maria, and Merry Christmas.
Merry Christmas.
Well, government vaccine advisors in the UK are recommending the booster jab for 16 and 17-year-olds. The JCV, that's the Joint Committee on Vaccination and Immunisation, also say vulnerable primary school children should be offered a low-dose jab. Well, here's more on the global COVID-19 update.
Wales has followed Scotland in announcing post-Christmas COVID restrictions. A maximum of 6 people will be allowed to meet in pubs, cinemas and restaurants, and 2 meters social distancing will return.
All alert level 2 measures, including retail and workplaces and the closure of nightclubs, will come into force from 6 a.m. on Boxing Day. The new measures will mean a general requirement of a 2-meter social distancing in all premises open to the public and in workplaces, subject to that test of reasonable measures.
Germany has announced that from December the 28th, limits will return that restrict private gatherings to 10 people and nightclubs will close. Football matches from that date will also be played behind closed doors. And Portugal has ordered bars and nightclubs to shut from December the 26th and has made working from home obligatory from that date until January the 9th. Outdoor gatherings will be limited to 10 people. The streets of the Netherlands are largely deserted as the country undergoes its 4th day of lockdown aimed at stemming an expected COVID-19 surge caused by the fast-spreading Omicron variant. The British government has reduced the COVID-19 self-isolation period to 7 days from 10 days for people in England who get a negative result on a lateral flow test 2 days in a row. With the Omicron variant spreading rapidly in Britain and record levels of cases over the past week, many industries are struggling with staff shortages, including hospitals who have warned of the risk of an impact on patient safety.
So today we will be cutting the self-isolation period from 10 days to 7 days for those people that take a lateral flow test on day 6 and day 7 and the result of both those tests are negative. This decision has been informed by the advice from our clinicians at the UK Health Security Agency, who have looked at this very carefully, and they are very comfortable that the protection that's provided by making this change so that people can leave isolation after day 7 as long as they've taken these 2 lateral flow tests and the results are negative, that the protection it provides is very similar to 10 days of isolation without tests.
Take a look at our website, channelstv.com. You find more updates and a better understanding of the pandemic, plus breaking stories, news stories as well. It's all at your fingertips. That's the program this evening. Thank you for watching. I'm Millicent Walker. Stay healthy.